Thank you. Yes, I do recognize a lot of your faces, and some I haven't met yet, so it's an honor. Normally, I prefer to come in a little earlier. I was late with a complex patient situation, which often happens in my type of work, in the type of work that we do. So this is my fam. These are my why. This is my 4 boys. They're all in different states. One is in a different continent right now and doing things to make our world, I believe, a much, much better place. But he'll be home in a couple weeks, and I can't wait to see him. And then my favorite human being, absolutely 100% in the world, is on our far left. That is Dee. She's my wife. She has supported absolutely every stage of this practice. We've been in practice over 27 years, and we have really fought and worked extremely hard to provide the best care available anywhere. And with that, I left the house at 6 o'clock this morning, and I have not seen her all day. So with your permission, once I'm done speaking, I'm going to dash right off and go have dinner with her. So I hope you'll give me permission to do that. The reason that I leave so early in the morning is because anyone watch NFL football? You watch them perform on the weekends, right? And there's a game. Those guys only work, they have the great lives because they make like $20 million a year. They only work 4 hours a week, right? Is that right? No. They work 12 hours a day, 7 days a week, most of the year, all the time. And that's what this level of practice that we do here is like. I had to show up at 6:15 this morning because I'm going to go through some of the things that we do for not just scoliosis care, but for everybody's care, because they're very, very specific things that every patient needs that are very unique to them. And so when uptime comes, we're all ready. Those of you who've been under our care for a while, you know that when you come in, it's like, oh, there's this paper that just says exactly what we're going to do for your exercise, adjustments, traction, all these different things. How do those appear? Because I leave at 6. So that I get here at 6:15 in the morning and prepare so you can have the best care anywhere. But that's why I get to go be with my favorite being in the world when I'm done here. So these things, where are these located, these structures? Anyone know? In Rome, right? These have been around for over 2,000 years. Okay, so why is that? Why? We have it sometimes when I give a talk, some of you have heard me talk about the Champlain building in Florida that in 2021, it's only maybe a couple dozen years old, and it completely crashed to the ground in December of 21, right? Killing over 100 people inside of it. And what is the difference between something like that and something that lasts 2,000 years? Well, it's what? What is the difference generally speaking? Simply put, it's the structure of something that determines its function. We know in every single science, in physics, chemistry, biochemistry, mechanics, every science that we know, structure determines function, except in modern medicine. We now conclude that if you're sick, it's because there's either too many germs, or there's too many organs in your body, or you have not had enough medications in your body. So structure is going to be very, very important. And I don't know how much physics any of you have as a background, but what are the main features of these structures that is making them last? The arches, right? Curves, okay? In your body, you should have 3 of them. This is an absolute normal on our left there. These are called 3 arcs of life. The curves are the shock absorbers to the spine. They're also the stability to the spine. The person on the right, so every person we measure compared to very well-established normals. This person has a curve in the neck, a curve in the mid-back, and a curve in the lower back, and they should be all stacked upon one another. And the closer they are to this green line, the better the structure of their body. So this person here, one of the biggest things we measure is the distance from this line to that line. And that line is what we call the sagittal balance. We're going to get a lot more into that. I'm going to try to not nerd out with too many words tonight. Some of it cannot be avoided. But what many, many studies have shown is that is one of the highest predictors of ability or disability as we age. And not just in pain, but we're talking in brain function, we're talking in memory, we're talking in balance, coordination, agility, of course pain, and many, many other factors in the body. So what we ask is mostly this, that people be straight up and down from the front or back, and they be straight up and down from the side. Pretty simple. this next picture, this is in San Luis Obispo. This is, I think, about 3 weeks ago. I say the other day, but sometimes when I say the other day, what I really mean is about 6 months ago. I don't know if I'm the only one. But anyway, this was the other day, but just a few weeks ago. So we were in the corner. That's my son walking with coffee for my wife. My wife is very peaceable. She likes her coffee extra hot, but when it's not, she just kind of doesn't say anything. She just doesn't want to cause a problem. So her coffee's not hot enough. So Bo goes to get, that's my third son, Bo. He goes to get a hotter cup of coffee, and he's coming back with it. And I can't help but notice, what is the main feature of this picture to a chiropractor?
The curvature and the guys
sitting there. Look what they're doing, okay? How many of you know people who are older who are bent over like this or have seen people like that? Every single person in here. When did that start in the generation who's like 70 or 80 years old right now? In some of them it started really young, but in a lot of them it started older and older and older, right? When is it starting now? Younger and younger and younger and younger, okay? This is what we're dealing with our kids. What I'm going to discuss, we see people as they age now, it is a much, much more serious problem than we've been made aware of. So why chiropractic exists and why chiropractic is even a thing is really not even the bones. It's been said that we're more doctors of the nervous system more than we are doctors of the bones. So what is it? We know that the brain runs every single cell, tissue, and organ in the body. But how does the body give life to the heart? How does the brain give life to the heart? How does the brain control the kidneys or the immune system or the digestive system or the reproductive system? How does it communicate? Through the spinal cord, through the nervous system, through the spinal cord, right? Exactly right. So 100% of the life begins in the brain and flows like a river through the spinal cord and out through the nerves between the bones of the spine to control every single thing that we are as a human being. Given that life itself is protected by the bones of the spine, how many of you think it would be a good idea to protect the spine? It's pretty intuitive, isn't it, right? We've just kind of forgotten about the vitality and the importance of it because we've been taught that health or sickness comes from germs or from lack of medications or from too many organs in our bodies. But the truth is that if we have life going into every cell, we have optimal function. But when the vertebrae go out of alignment, I'm going to give you a couple new words. The first one, most important, is the word subluxation. This is a form of it, subluxated. We're all going to say, not yet, I'll count to 3, but we're going to say subluxation. Okay, 1, 2, 3. Subluxation. Brilliant job, class. Class! Sorry, what that means is that a vertebra or a group of vertebra have gone out of alignment and it's choking off life, so the brain cannot coordinate every cell, tissue, and organ in the body properly. So that is what we're dealing with. So the work that we do here in this office is called CBP, or chiropractic biophysics, or clinical biomechanics of posture is another way that this is phrased. And so what it means is that we're going to analyze the spine, or what we call the neurospinal system, according to norms and standards, and we're going to work to get it as close as possible using, well, complex in a lot of ways, but simple applications of physics to get us as close to that normal as possible. Because the reason that we exist is because I want you to be not just 15, 20, 30 years old at optimal function, but I want to see you at 80, 90, 100 years old in real function, doing the things that you really want to do, picking up your kids and grandkids and playing golf and doing all the things that you really, really feel you want to do, okay? How many of you think that that's a good idea and that you want that, okay? Everybody wants that at some level. So a little bit more about that. Denise here has been a patient of mine for a long time, but she's going to tell you part of her story. Different Denise. I'm not going to call on you. Sorry.
I wasn't prepared.
Two Denise. Okay. You're going to speak in 7 minutes. You're scheduled. No, anyway. Just kidding. Another Denise. She's been a patient of mine for a long time, but she's going to talk a little bit inadvertently about the transition that we've gone through in our practice. So this is Denise.
My name is Denise. I have been under Dr. Todd's care for about 15 years. And I was diagnosed with scoliosis when I was 13 and have had neck and back issues pretty much my whole life. Through regular adjustments and exercises from Dr. Todd, I have a lot more mobility and a lot less pain. A year and a half ago, Dr. Todd shared with me a method to improve my scoliosis because even with consistent care, my scoliosis was still getting worse. The cost and the method was not at all what I wanted to do, but I didn't want to be crippled with back pain and deformity later in life. So I went forward with wearing the scolio brace and doing everything that Dr. Todd asked me to do with the exercises. It was a big adjustment, but I wore it for 6 months, pretty much 24/7. My back improved greatly. I now only wear it about 10 hours a day, and it has just been so worth it. So I am telling everyone I can about my success, because a lot of people say that there is no cure for it, that there is no hope for it, but there is. There is help for scoliosis, and I'm just so very grateful for Dr. Todd for sharing this with me.
So she lives way out almost all the way to Lassen, so she couldn't come and speak tonight, so she sent this video. But she talks about, so for years, the only type of care that we did was general chiropractic care, which was just making adjustments on people, which I still very, very, very much believe in. And if I ever frustrate you, which happens, go see another general chiropractor and get adjusted regularly. I very firmly believe in that. But what we found is that people's structure often wouldn't improve. Their scoliosis would not improve. And just like we could slow the progression of the curve down, we could slow the progression of the degeneration down with adjustments, but we weren't able to stabilize or correct the curve. And so that's where we learned about newer systems that really, really do provide hope, and for very good reason. So first I want to talk about what is scoliosis. We all kind of know that it is a sideways bending of the spine, okay? So it's a sideways curve in the spine. There could be many causes. In children, it mainly occurs in adolescent girls, starting between 10 to 12 years of age. We'll talk more about why in a minute. It will usually get worse with growth or age. And adults can also have scoliosis, either stemming from when they were adolescents or most commonly developing later in life. So this care should be very, very, very specific to each individual. This was a class like 3 weeks ago in my office. This was not a scoliosis class, but when people have abnormal postures, we had 20 people there, and we're teaching people to integrate corrected postures into their bodies. So there's thousands of different things that we look at, which is why I have to get there early to analyze very carefully what they're going to need. So what we're doing in this class is we're doing movements that are very, very specific to that person. We had 20 people, and not one of them had the same types of movements that they needed to correct their posture. So it's very, very specific. So if the bend in the spine is above 50 degrees, surgery is usually recommended. Can everyone imagine what I mean by how many degrees? So 45 degrees is halfway to 90, right? So 50 is slightly more than that. We're going to cover why it's usually recommended at that. So patients with scoliosis can develop back pain, asymmetry in their body appearance, and postural deformity. So what does scoliosis awareness mean? So it means being aware of what it is, being aware of who can be affected, recognizing the signs, which we're going to get into in a moment. Do you have a question, please?
The slide back there with the lady,
Mm-hmm.
how much percentage does she have?
I don't know without looking at her x-ray. This is just, we mark up the back of the skin so that we see when they get in different dynamic positions how much we go. My guess would be that hers is about 60 degrees right there.
Wow.
That's my guess, but I don't know. But x-rays are absolutely critical to know, but that would be my guess. Okay, thank you. Good question. Questions are welcome. So knowing where to find treatment if it's needed, which it isn't always, and sharing this information with family and friend. And by the way, Denise earlier in the video brought up the bracing. Not everyone needs a brace at all. We'll get into that. So who can it affect? So it can run in families. The prevalence of it increases with age. Approximately 30% of people over 60 will develop an adult scoliosis. That number, depending on the study that you read, over 80, it's either 50% or over 60%. Different studies say different amounts, but it's very, very, very prevalent as we age. It increases rapidly from 11 to 14 years of age as they grow. We'll talk more about why and what to do about it in a moment. 2 to 3% of children aged 10 to 15 will have a scoliosis. Infants and juveniles can also have it, but it's much, much more rare, especially in infants, thank goodness. So why does it happen? Idiopathic scoliosis, it means we don't know why. but we do know that there may be a family link. We haven't isolated genetics yet, a little bit possibly. But we do know that it is not just a curve, but the bones of the spine change shape the bigger the curve gets. And I'm going to explain how and why in a moment, because that's extremely important in analyzing and dealing with it. So adult scoliosis can either be they had it when they were younger and they've just grown with it, or more commonly, what it means is they never had it, but for reasons we'll cover in a minute, they develop a degenerative or de novo or formed new scoliosis. So this is a patient of mine that we got to too late, so we're just doing damage control in him. He just had his 90th birthday, and people say, well, he's 90, so of course he's going to have degeneration, but that is not necessary to have in most cases. So the green line is the normal. This is the side view of his lower back. He's looking that way, okay? So he's way too straight. What is the job of the curve that we talked about a little bit ago? It's the shock absorber, like your knees are shock absorbers for your body. So if I had a full body cast from my toes all the way up to my neck here, and I had to go down 30 flights of stairs, how am I going to be doing at the bottom of that, right? Pretty bad, right? But if I can bend my knees, I'm made for that, okay? My dog and I just went on a long run. Some of you know I broke my neck last October. I just went on a long run last Saturday with my dog, and we're going up and down those hills everywhere. It's because we're designed to move, okay? Another side tip, I have a bunch of talks about general health, and you can, if and when you come into the office, you can scan those and look about how to exercise, how to provide proper nutrients to your body, stress management and other things. So these are all important, but structure is the most important. So we look especially in the bottom of his lumbar spine here. This is his tailbone. He's lost most of the curve there. So the stress should be going into the curve, but where's it going? Into the what? The joints themselves and the discs, right? And God made us really, 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 really resilient, right? But there's only so much resilience we can have when all that stress is going straight into the joints. So we look here, he's degenerating, meaning these discs are collapsing on one another and the bones are physically changing shape. And we look at this plane right here, so this is his right hip and his left, he's facing us. You see how his number 5 vertebra here is tilting off to the side. So what's happening is, as the stress goes onto these joints, the spine degenerates, and it usually does not degenerate symmetrically, meaning what? It's going to degenerate asymmetrically. So what's happening is this. So the vertebra, these are terrible examples of vertebra, but it's the best we have. The vertebra are, they're not, the reason that we typically have curves in the spine is because they're wedge-shaped themselves. So if we see this like this is how we have a curve, is because our vertebra they're wedge-shaped, right? They're shorter in the back, in the lower back. So, but what happens is, when they start to turn, they start to wedge, and when we have a wedge facing sideways, what happens to our back? It starts to bend sideways, right? That's a degenerative scoliosis. This is what 1/3 of adults over 60 and between 50 and 66% of adults over the age of 80 develop in their lifetime, okay? So one very, very important thing is this cannot be totally corrected, right? Because the bones are now wedge-shaped, and we're going to look a little bit more closely at that in a moment, okay? So we do know that early and accurate detection leads to the most appropriate treatment, right? It can be the difference between a patient needing to undergo surgery. I don't know if you saw what the surgery was. Has anyone known anyone to have a scoliosis surgery in here? We just sent someone for scoliosis surgery who needed it. We tried to catch it early enough, an adolescent girl. We didn't catch it quite early enough. We even braced her, and more on that in a second, but sometimes that's essential. Oh, I thought there was a question. Okay, so even in adults, the earlier appropriate treatment is started. Please, question?
Can you get scoliosis from an accident or from an injury?
That's a great question. Everybody hear that? Can you get it from an accident or an injury? Yes, there's 2 types that cause that. So there can be a trauma that causes the muscles to splint, and a traumatic scoliosis, what we call. And so that wouldn't quickly be a true bony deformity, but that's one type where the spine is just buckled, and that's what we would call a functional scoliosis, meaning it's really just muscles and ligaments temporarily. But as you're saying, over time, it can degenerate further, and I'll explain that more in a second, okay? Make sure I answer your question if I don't. So the research says that the Scoliosis Research Society, these are like the premier group of scoliosis researchers in the world. They're documented benefits of earlier detection and non-surgical management of, this is adolescent idiopathic scoliosis. There are benefits. People say there's no hope. There is absolutely hope when it's done right. So recognizing the signs, I'm going to teach you guys how to actually screen for scoliosis. This is very, very important. There's no consistent screening in schools. It's important we all recognize the signs. Summer can be a great time to do that. So I was thinking about maybe doing this in here, but we don't need to do that. So have the person stand in front of you that you're looking to. Let their arms dangle at their sides. So we're looking for shoulders being unlevel, left or right, could be either one. We're looking for prominent shoulder blades. We're going to talk about why a shoulder blade gets prominent in a moment. A visible curve that we see in the spine, like you asked, where we dotted the bumps in the back of the spine before, and then waist is asymmetrical, okay? So have a forward bending. This is what they used to do in schools. They're not doing as much. We have them bend forward, and we're looking for rib humping, either in the mid-back, that would indicate a mid-back scoliosis, and we look for it in the lower back, and everyone see that those are not symmetrical, right? Because one of the most important features of scoliosis is it's not just a sideways bend. One of the most important planes to deal with is what we call the transverse plane, or the rotation in the scoliosis. If that's not dealt with, we're not actually dealing with scoliosis properly. These signs can indicate a possible scoliosis and means someone qualified should be looking for it. So we have an app. You can go onto my website. I'll show that in a second. And it shows you specifically what we just went through, and it helps you be able to screen. So screen your nieces, nephews, and in case I forget this later, if you have family in Timbuktu or in New York City or whatever, and you think they need proper care for this, all the people doing this level of work I pretty much know, and if I don't, I can find them. This is less than 0.1% of chiropractors who are trained at this level, so we pretty much know each other. We're on regular conference calls sharing difficult cases, and we pretty much know each other. So, but again, some care is better than none. So if you have people you care about somewhere else, please let us know, and we will help you find the best people. So this is a 10-year-old girl in this picture. So she has technically a scoliosis here. Does everyone see that bend right there? But this is the top of her femur bone, okay, on her left side, and this is on her left, and this is the right side. What's causing that scoliosis? Compression and rotation, right? But it's derived because her left leg is shorter than her right. Can everybody see that? This has to be dealt with radically different than other types of scoliosis in that, number one, what we do in her case is we actually put a foot lift under her left shoe, and I won't get into massive bone growth laws and things like that, but what we do know is the reason they get worse is because when someone's still growing, the pressure on this concave side causes bone growth to decrease. So it goes more and more and more, and that's when it starts to rotate and cause an even bigger and bigger problem. And so that's what starts to happen to that scoliosis. But when we put a foot lift in while there's still growth, so the earlier we catch this, every day matters. While there's still growth, we put a foot lift in, and that levels out the bones, and it can cause the bone, this leg, actually, we have research that it will actually increase bony growth in this leg, and it can level that out. One moment. It can level that out. It can increase the bone growth in that leg and then permanently prevent a future scoliosis, right? So sometimes in her case, all she needs is that foot lift. But if we just start exercising and traction, she needs exercises at least for this, but if we only start doing that but ignore this, it's not going to correct because it's a leg length problem first. Go ahead, question?
So I actually had that when I was a teenager.
Mm-hmm.
One leg grew faster than the other.
Uh-huh.
You know, when you're a teenager, you grow like an inch
Yep.
a month.
Yep. Uh-huh.
And I had real bad sciatica, so
Mm-hmm.
I put a lift in one leg.
Smart.
And
Uh-huh.
it made everything go away, and then just a month or two, it was okay.
That's awesome. That's what should be happening. You had some advanced care. Good work. So yeah, so get that. So ScoliScreen is the the site that we talked about. It's on my website. There's also just an app you can get if you're interested. But this shows you how to screen. So I would recommend that you share this with your family in in Pennsylvania and wherever they are, that they screen your nieces, nephews, grandkids, and everywhere that they are, because the earlier detection, by far the better. And we have people coming to us from all over the country, but it's easier if they're in New York City if we find someone in there for them. That just shows how that works. So what happens if it's not detected earlier? Early diagnosis is in our hands. Large curves were once small, right? They start off as very small, right? So this is an actual case of the same person, a normal spine pre-consultation. I thank goodness don't have any cases like this, but one of the guys who's in our group that we share cases a lot together, Dr. Joe Betts, who's absolutely brilliant doctor. He showed us this case of a guy who he brought his daughter from Brazil up to him. He's in Idaho, and he did an exam on her, and they found a curve like this, and he said, "You got to stay here." He recommended that they stay in there for, I think, 6 weeks, and they were going to do work like 3 or 4 times a day for 6 weeks on her. Very, very intensive program. He's like, "Nah, don't worry about it. Like, I think it's going to be fine. We have this simpler program here in Brazil." So he didn't do it, and she came back, and this isn't her actual case, but it got much, much worse, and she's since had surgery. We want to avoid that if we can. So what about treatment? Number one, everything I'm going to go over is possible. Not everyone needs everything that we recommend. That's super, super important to get. Treatment will depend on the age, the stage, and the type of scoliosis, since there's so many different types. But research has shown that non-surgical treatment options of scoliosis, specific exercise, targeted traction, and 3D custom scoliosis bracing, as well as other scoliosis orthotics, have documented benefits. So goals of care typically, when we have scoliosis, will depend on the same factors we just talked about. But one, we want to improve the quality of life at every stage. We want to stop the progression as best we can, because the natural history most of the time is progression. We want to improve sagittal and coronal balance. I've talked a little bit about that already, but I'm going to show you exactly what that means in a moment. Decrease the curve. What does AMAP stand for? As much as possible. Decrease the curve as much as possible, which we cannot always decrease a curve, okay? But whatever, if there's a method that's going to do it, we're doing it, okay? And in the worst cases, hopefully just they're going to have a better surgery because the curve is more flexible and the curve is reduced at least a few degrees in the worst cases. So this is Elena. I have permission to use her name and her case, which is why her face is not blacked out. So coronal balance, one of the highest predictors of disability with a scoliosis or with any posture, is being shifted out of alignment in what we call the coronal plane. So her being like this is a very, very high predictor of not going to be able to do what she wants to do as she ages. So I don't have her x-rays here, but I can tell you we reduced her curve only a couple of degrees, but we greatly improved her coronal balance. Now she could barely walk when she came into us. Now she's in Shingletown. She's out in her garden. She's doing all kinds of things, and she's doing what she's made to do. Sagittal balance is just a fancy word for how shifted are we this way. So a story that some of you have heard. My second son went to the U.S. Air Force Academy, and he was a distinguished graduate there. And so he graduated right before President Biden was done with office. And I'm watching, he got to shake the president's hand, which is an amazing, amazing thing. I don't care what you think of the president, that was awesome. But I'm looking at, guess what, with President Biden? His posture. And he's like this. There is predictable cognitive, meaning brain function decline for every millimeter we go forward here. It's predictable, okay? The Kamitani study shows that. Pellice study, 2015, there are hundreds and hundreds of studies of all this, but shows that if we're over 50 millimeters forward here, it's worse for our overall health than chronic diabetes, chronic lung disease, chronic heart disease, chronic arthritis, and one more thing that I can't remember what it is, but it's severe. We're dealing with malfunction in people. So we want everybody say function. We want function. And I had a patient that it hit my heart significantly just a few weeks ago. She said, all these doctors are always telling me what's wrong with me. I want someone to tell me what we can do, what's right, and to provide hope. I'm the last person ever to take away hope. So we're here to provide some hope. So each case is very different and requires expert assessment and the right treatment. In small postural curves where the scoliosis is less than 10 degrees, no scoliosis specific, that's Say that 3 times fast. No scoliosis specific treatment. No brace would never be required in less than 10 degrees, or scoliosis specific exercise is normally needed. Usual traditional chiropractic care and rehabilitation is the first choice. Careful monitoring is also recommended so we can watch it. When it's larger than 10 degrees, it's important to have an expert assess it. Scoliosis specific exercise is often the first choice of treatment for small curves less than 20 degrees. In cases with a strong family history or where it's the patient's preference, nighttime or part-time bracing can also be considered. This guy just showed up to me a few weeks ago. He came in, he was going to a traditional chiropractor, which is awesome, and his back pain wasn't responding, so she ordered x-rays. She ordered x-rays, and this is the actual x-ray from Dignity Health there, and from their radiologist said that there's a scoliosis here, okay? So he comes into me because his back pain is not resolving, and the doctor's care didn't change based on pre-x-ray and post-x-ray. There was no difference in the care, so he's like, well, why do we even take the x-rays? For me, an image is so we do something different based on what the image shows. So we x-ray him, and we see that. So this is his left side here. His tailbone, his sacrum, is lower on the left side than on the right. Should we know why that is? If we want to correct him, we darn well better know why that is. And we look at the side view of his low back. He's facing this way. So we draw the green line here, which you can only visualize. The radiologist missed that this segment is behind that one, causing major low back pain. And what they didn't miss, he called this a scoliosis, which it technically is, but I don't like calling it a scoliosis because the cause of it is this, okay? Remember the girl we looked at? What was the cause of the 10-year-old girl's scoliosis? One leg is shorter than the other. That's exactly what he has. Now, we're not going to do anything to make the leg grow because he's skeletally mature, but this leg is still shorter than the other one, right? So we're still going to have to put a lift in. We could literally do exercises twice a day, every day. We could traction him every day, and we could put a brace on him. Is that going to fix his short leg? It's not. He needs very, very tailored care to this. So we're not doing anything specifically for this except lifting this up, and we're going to track over time what happens to his sideways curve, his coronal imbalance and his sideways curve here. That's the only way, unless we fix that. So he definitely does not need a brace, but he's also lost most of the curve in his lower back here. But if we don't correct the leg length inequality and we don't fix the lack of curve down here, there's a certain number that should be, and his is way below that. Remember the 90-year-old guy we looked at earlier? What's going to happen down there? It's going to degenerate, and if it degenerates asymmetrically, which it's going to because it's already tilting that way, what's going to happen there? It's going to cause a worse and worse and worse scoliosis, causing more and more pain, right? Does that make sense? So more on that. We also look at his upper middle back here. He's developing an actual scoliosis up here, so this may need some exercises and traction. We don't know till we track over time. We want whatever's going to be effective. Everybody's different, and they all respond differently. So if we look at, this is his total overall posture stitched together. We look at 100 people with this x-ray, they're all going to need different things to get corrected. That's why it takes so much time in NFL day. It's not just game time. It takes time in practice to be able to figure out what's going to happen with this. Does that make sense? So this is him with a partial foot lift. This was September 12th, and he went on vacation for 2 weeks, so we haven't had him back yet. We put a lift in his shoe, and we see that this buckles all the way to the opposite. So this is a complicated case, and as most are, people have a right to respond how they respond. It's not a simple thing to just get this all the way corrected. So, but we are going to help him. So corrective exercises. So what a lot of people think is that a scoliosis is just a sideways bend and that it's really just muscular. Okay, so I very, very frequently refer to physical therapists or to general chiropractors for different things. I just referred someone who doesn't need my type of work to a general chiropractor just a half hour ago, which is why I got not half hour, maybe an hour ago. Remember I said the other day, but it really means 3 weeks ago. But anyway, so because she doesn't need our level of care. But this gal does, because this vertebra is wedge-shaped down here. She's buckled off to the side. So we can't just if we just strengthen in this posture, which I love physical therapy, but that's mostly what it does, is it's symmetrical on the same both sides. Does that make sense to you guys? They're just strengthening, which can be useful, but it's not going to correct that. So she has 3 different postures here. She has a shift to the side, a bend, and a twist. These are all 3 different things. Now, I hate to confuse you by saying we need to derotate all of those, and we need to specifically do that in these exercises, but what's even worse, anybody in here an algebra fan or pretty decent at math? Okay, excellent. Okay, this is what's even worse, and I apologize in advance, but people reserve a right to need the very specific care that they need. Everyone take out your phone. If you don't have your phone, take a piece of paper or something else. Okay, so this is the patient's neutral, an angle of 32 degrees. Okay, that is a broken, weak, injured posture that's unstable, right? And if we don't do something about it, what's likely to happen? It's going to collapse on itself. It's going to get more broken and weaker, okay? So this is one sequence of motions, twisting, bending, and shifting, okay? We know that it's 3 postures, twisting, bending, and shifting. This is the same movements in a different sequence, okay? So everyone take out your phone and hold it in front of you, and if you don't have one, so it turns out that there's something called, in algebra, there is the commutative property, which means if A plus B equals C, the commutative property means B plus A equals C. Turns out that with finite rotation angles and bends in the spine, they're non-commutative, which means this. Different order means different movement, means different correction. You're starting to see how difficult this is as a doctor to deal with this. So take your phone, bend it forward so you're looking at the flat edge of it, okay? And now tilt it to the right, okay? So you're looking at all the way, full 90-degree turn. Sorry, I should say this specifically. Look at it like you're looking at the face and pretend start over. Look at it like you're reading something on a text. Now bend it 90 degrees forward away from you. So you're looking at the bottom edge like where you'd charge it, right? Now bend it 90 degrees right. Everybody's got it, good. Okay, now remember that position. Now look at it again like you're looking at it normally. Now bend it 90 degrees right. And now bend it 90 degrees forward. Different position, ah! Okay, so people reserve the right to need very, very specific care, okay? So this person, totally same exact motions in a different order. So there aren't a lot of docs who know this or certainly work with this, but we have to work with this. Not every curve needs this, but those that do, they need it, okay? So how many of you would, this goes down to 19, which is pretty decent. This one goes all the way down to 12. Now, because we're dealing with a lot of scar tissue and bony deformity, we may not get the person all the way to an angle of 12, right? But we might get them halfway in between there. Okay, does that make sense? So we're going to have to work hard to get there because there's a lot of scar tissue and it's not like an overnight thing. If I were to ask, can any of you do the splits right now? Okay, me neither. I am very, very far from it, okay? If we were to try to coach you to get the splits, could you stretch once a day for 2 weeks and do the splits in 2 weeks? No chance. The reason is the same. Those tissues are stiff and they're not moving very well. They're going to need very, very specific movements over a long period of time and for the same reason to get them to line up properly. What if I just adjusted your hips and then you did the splits? Could you do that? It's not a thing, right? It's going to take some serious time, okay? So exercises, then traction is very specific as well. So we see in her, she has a very, very complex curve. So this is actually the same person. So this is her curve started in her lower back and they're starting to twist, which means the vertebrae are starting to shift and collapse. Her posture's collapsing on her. She already has degeneration in through here. Should we have caught this now or when should we have caught it? A long time ago, right? But we didn't. So people reserve the right to do what they do. And she has a compensatory curve in her middle back. So she's lost a lot of her coronal balance, right? So prediction is rough. Who's a Rocky fan? Everything I see is a movie line of sometimes. Rocky 3, Clubber Lang, Mr. T, right? Clubber, what's your prediction for the fight? Prediction? Pain. Anybody? That prediction is pain, right? Sorry, and I don't mean to make light of her situation, but that's the way my brain works, is everything is a movie line. So she needs specific traction that's going to work on her coronal balance, going to work on all three postures that create this all at the same time, and steady and slow move. Wins the race is the word I'm looking for, right? This won't go all the way to normal, but we want it as close as we darn well can. Please, question?
When you start scoliosis, or does it start like in one spot and then the rest of the spine compensates for that and kind of creates scoliosis in a different spot?
Much of the time, yes. It depends on the type of curve and how the body responds, because it often responds differently. In her case, exactly right, because God made us very brilliant, right? And so, but there are limitations to the compensation. We would hope that, well, the fact that she's coronally imbalanced actually makes the prognosis for correcting the curve a little bit better, because once the body finds stability, it's much, much harder to correct. But if we don't correct it, she has a much higher likelihood of much further pain and much further degeneration. So it's kind of a toss-up. Another question, please, Gary? Oh, no, Kyle?
So as the back gets further out of alignment, let's say, does it lose blood flow as well?
Yes, blood flow and especially nerve flow.
Yeah.
And we know that the spinal cord itself, we lose blood flow perfusion to the spinal cord itself, so it starts to slow down transmission through the spinal cord and all these other things that are things we ideally do not want.
As it straightens out, that will improve as it does.
100%. Yep, exactly. So posture corrective adjustments have to be tailor-made to what the patient needs specifically. And then there's home scoliroll or home rehabilitation. So most people need orthotics for home, and these are specific where we have to deal with how the head shifts, how the mid-back shifts and all this. These can't be as specific or as targeted as traction in the office, but if you're only in the office 3 days a week, it's tough to move these things. They're very, very stiff, so we've got to have daily home supportive care. One of the things our doctors groups say, we stop saying homework, right? Because people don't want to do homework. Now we call it home supportive care. Okay, we got to be politically correct. So bracing, for those who need it, it works like this. So specialized scoliosis bracing, when prescribed for high-risk adolescent patients, has been shown to prevent the need for surgery in most cases. It's an effective treatment for adolescent idiopathic scoliosis cases characterized by positive long-term outcomes. Part-time bracing in adults significantly reduces progression of curvatures and improves the quality of life. So there are a lot of different braces out there. I had a patient bring something, I couldn't find the exact one, something that looked like this, that an orthopedist in town prescribed. Over $6,000 for that thing. And it was like a series of cables that like literally, it was like, I'm in the wrong profession if money's what I'm after. Let's put it that way. Who's seen Zoolander? Okay, anyone? I feel like I'm taking crazy pills! And then there's this one kind of looks like what we do because there's butterflies and stuff, but most of these braces at best hold someone in the same position that they're in. At best, they're working on not letting the posture get worse. So we do something called ScoliBrace, which is very, very specific laser-guided scanner that exactly gets them into their exact scan of their 3D representation of their body from here down to here. Then, based on how correctable the curve is, we do a series of x-rays to see how flexible the curve is, how much correction they can get. This is a true 3D corrective brace that shifts into correction in all three planes. It's the only brace like it in the world. A lot of braces, they're called custom, but what that really means is there's like 5 to 7 different designs, and there's small, medium, large, and extra large, and that's what custom means to that. This bracing, a ScoliBrace, we custom order them with the laser scan. They manufacture in Australia, then they ship them to us, and then I spend often many, many different days, many different hours cutting and tooling and fine-tuning it to that person's body, because no matter how perfect it's made, sometimes we need a tune-up, and this is where my carpentry skills went from 0 to, not 100, but let's say 20. Please, question.
How many of those have you made?
I've made about a dozen. But of those that I've made, they've never made the same one twice. And of all the thousands that have been made in the world, they've never made the same one twice, because they're all super, super specific. And so these aren't going to correct every curve, right? Because some curves are beyond correction because of that bony deformity. But what they are going to do, when someone is in a serious, serious postural defect, they're going to lift and derotate and take someone out of that broken, injured posture that's working on sliding downhill and becoming worse and worse and into a true corrected posture. Ideally, we capture this when someone's still growing, because you remember we talked about that 10-year-old girl, that if we can capture it, if someone's bent over here and if we can lift and put them into a true corrected posture, it's actually going to increase bony growth on that concave side, so it can help to level them out. Growth is so important for this. But even if someone's 60 or 70 years old, sometimes they benefit from a brace too, because it's not going to change the bones. Like we're not correcting it. That's a structural scoliosis. Remember we talked about we are not going to fix this, but we can level it and lift it like this and take some of the pressure off and reduce pain, and hopefully, like we did with that gal Elena, correct coronal and sagittal balance. Does that make sense? Pardon me?
Who was the guy in the picture?
Oh, that's me. Yeah, that's me. Yeah, so.
Is that your brother?
Yeah.
And your twin.
Why? Because he's more handsome or something? Or, that's me. So, yeah. Oh, yeah. So that's me in protective glasses. I value my eyes and all that. So yeah, that's me going from 0 to 50 or 20 in carpentry or whatever you want to say. Yeah. So anyway, so regular screening and detection equals better outcomes and treatment. So this is an interesting one. This describes a little bit more about what we're talking about, the wedging here. Okay, so this is the lowest vertebra here, and you see this. I just took this picture. What was that? Yesterday. So we see that this lowest vertebra here, the tailbone is level here, but this one, it degenerated more on one side than the other, right? So we're not going to fix the shape of the bone. This person is fully grown, but we can lift it and create some correction with that. Does that make sense, everybody? Okay, so be proactive and scoliosis aware. So number one, look after your spinal health. Do regular at-home checks, especially when growing. Watching and waiting is the most common approach, but it is the most dangerous approach, okay? The most dangerous approach, yep. And then seek professional advice when necessary, okay? So I'll answer questions in just a moment. But so here's what we do next. If you're a current patient, I want to ask you, increase your commitment to your home supportive care. If you already, I hope you kind of got a boost of energy and verve for this, if you will. Boost your commitment to your home care. It's very important. There's a few patients here who are under this type of care, but I want to say, if they spoke, they would say that this isn't always easy. Caring for your scoliosis is not easy. Just had to x-ray someone who we had to get in the x-ray room and put them on this orthotic and take x-rays in the orthotic and move around, and it's painful doing some of this stuff, right? It's not fun, but I will suggest that it's far, far better to do the work now than to let it get worse and go through more pain later. And I was explaining this to someone just earlier today. How many of you have ever been to a chemo floor at a hospital? If you've ever been that is an experience. So those people go through that, and there's literally crying and screaming and vomiting, and people who are literally green, discolored, and very, very sick. And so why are they doing that? To get better, right? To live. Because our medical system has made something, and I'm not saying it's right or wrong, but the goal of chemotherapy is to kill the cancer slightly faster than it kills the person, right? But they do that because they think that there's something better on the other side of that. Now, sometimes there is and sometimes there isn't, right? The doctor's just doing the best they can. I'm not faulting that, but I want to say that this isn't that bad, but scoliosis care can be similar. That you got to work hard to be able to win at this game. Some things require some serious things. And I was just advising someone early this morning who has a chronic lung issue. And he's like, wow, man, these doctors, I feel like I show up and they're looking at my chart right in front of me. Like they don't do any homework before I even get there. And I'm like, oh my gosh, I can't imagine thinking like that. Like he shows up and they're like, oh, they don't even know what the doctor before has done or anything. They don't even know what the prognosis is. And that just drives me crazy. But it's like, he's got to do some real work to get through with this lung issue. And I'm not an expert in that, but I am an expert in you got to do some work to do things that are necessary, right? So now is always the right time for scoliosis treatment. So at this time, I have some moments for questions. Does anybody have any more questions as we go? Please.
Well, I had the scoliosis surgery, and my spine was 65% curved.
Uh-huh.
That was like 20 years ago.
Yeah.
My son has scoliosis, and he's 8, and he has a 30% curve.
Okay.
Mine was caught when I was 12. His was caught when he was 7.
Mm-hmm. Good work.
And we were already seeing some specialists at UCSF because
Mhm.
of craniostenosis. So now we have scoliosis. And just my own personal experience, so please don't be offended, but
Yeah.
I was always told that chiropractic work, for me personally, I
Uh-huh.
was never allowed to go see a
Yep.
chiropractor.
Mm-hmm.
I was told so.
Yeah.
So,
Yep. Mm-hmm.
I mean, your presentation is very appealing and sounds really great to a mom who would never want her child to go through what I did.
Right.
Twice, actually, because I broke my spine in 3 places and my rods. So I had to have the surgery a second time, which was far worse. But, so what I'm asking is, how would you approach a young child like that? And would you partner with his medical doctors or medical team?
Mm-hmm.
Like going forward, because obviously I want everything to do everything for my son
Yeah.
to prevent surgery.
Mm-hmm.
But at 30%, at 8, he hasn't even had a real growth spurt, you know?
Yeah.
So I'm just wondering what your thoughts would be on that.
Yeah, so did everybody hear that? It's a really, really good question, and so I'd be happy to meet with you specifically. But the reason that people say, and there's a variety of reasons why people say don't go to a chiropractor, and some people say that regardless of scoliosis or not. They think that we're just going around and just ripping bones around and that's all that we do. I'm sure you can see that there's a lot more to this approach than most chiropractors would normally do. There's even a lot more to this than UCSF is the pinnacle of orthopedic work, even in scoliosis. Them in this state, it's either them or Shriners or UC Davis. So you're, in terms of the medical work, that's the best of anywhere. I will be happy to communicate with any of them. They probably will not understand fully what we're doing. Most of them think braces are worthless because they don't know the brace that we have.
We're actually this looks exactly like the brace you ended with.
Mm-hmm. Yep.
Which he needs a new one, so
Mm-hmm.
he's outgrown this one, but.
So I'd be happy to look at any of it. So what we typically do when someone comes with an old brace is we'll take an out of brace x-ray and an in brace x-ray, and either it's correcting them or it isn't. And so, like, there are a couple braces in the world. There's a group in Italy that does braces that are kind of similar. There's a group in Chicago that kind of took our data and is doing something similar to what we're doing. I don't know who made this brace, but the proof's in the pudding, okay? And I will gladly talk to any orthopedist, any neurosurgeon, anybody and communicate with them. The question would be more, would they talk with me? And they may or may not. But I will tell you that as a father myself, I would do anything and everything to be able to support someone's child when they bring the child to me. And when I take it extraordinarily seriously, when someone hands me their child, I have a child who had an open heart surgery at Stanford when he was 4 months old, and the feeling of handing your child over is indescribable. You can't explain that to somebody. But I will say that if even just to look at him, I'll give him the very best of anything I have. And if I think he's doing great where he is, I will definitely let you know. But if I think there's improvement to be made, it may be just exercises, but he's doing well with the brace, or maybe home supportive care, whatever it is. Not everyone needs everything, and I'll be glad to communicate with anybody you like. Does that make sense? Okay, of course, absolutely. Please, another question. Mm-hmm.
Not to get off the subject, but since I last saw you,
Mm-hmm.
I've developed a real serious vertigo, dizziness,
Mm-hmm.
bad. And I mean, I have face planted several times.
Yeah.
And I don't always feel it coming.
Yeah.
My here.
Yeah.
And now I was trying to read up on it,
Uh-huh.
because I had the dizziness similar when I had
Yep.
pneumonia.
Yep. Mm-hmm.
This is different.
Okay, yep.
And I heard it can be from the scoliosis.
Yeah.
Is that, I mean, what should I be concerned or watching for?
Let's get back to
I will
work.
get back to
Yeah.
you
Mm-hmm.
soon,
Let's
but-
get back to work because, yeah, that mostly has to do with the alignment of the upper two neck bones.
And my neck's bad.
And it can be from abnormal forces put on by the scoliosis. So we need to get a look at you again. It's probably time. Okay? Yep. Okay. One more question. Sure. Mm-hmm.
Okay, that's a big one.
Okay.
Cost.
Okay.
Insurance, most of the time, I just do the basic because insurance, most of the time the insurance didn't cover anything.
Yep.
So it was out of pocket.
Yep.
And now, and also back then, it wasn't taken seriously as it is now.
Yep,
I think it's
yep.
more recognized,
Mhm.
kind of thing. So different things, but nothing too serious. And so I've just kind of maintained with that.
Mhm.
So my concern is, part of it is the cost.
100%.
Medicare will give you 12 sessions.
Yeah. Yeah. Yeah.
That Medicare,
Yep.
yeah, that's
You do
true.
what?
That's only for very basic, but if you do anything more than that.
Well,
Yeah.
my doc is, I'm that one that goes like this, like this, like that.
Mm.
So,
Yeah, so that's what, and then like, if you do take that.
Yep. So Medicare covers adjustments. We're doing an exam that's a discounted exam, which includes all the X-rays and all the analysis to kind of figure out where you are now. That's normally like $380. It's $67. That's just a preliminary screening to see where we are, and that means looking over whatever previous films. If you have any, I always take my own new ones because it's tiny, subtle differences. And you saw the guy where they only X-rayed this, and they didn't know that it was caused by a short leg, and there. So many factors, but what it takes to kind of build the case for what you might need is $67, and Medicare doesn't cover any of that, okay? Then typically it would be like most people are a couple weeks course of care to adjust a little bit, see how you respond. Not everyone needs that, but the general course, and then some kind of corrective potential X-rays where we move into a different posture. You saw where the 3 different movements made totally different results in the alignment, so that's additional, but it's maybe a couple $100 for those next couple weeks. Then we build a plan based on that that's more longer term and more stability creating. Does that make sense? Okay, fair. Is that a good enough answer? Okay, perfect. Another question, please.
Do you take X-rays in your office?
Yes, because of great precision. So just a slight twist in the pelvis will make one leg look longer or shorter, and there's all sorts of things. And then we're the only ones who know how to apply the orthotic so that we can take the picture there. So yeah, we take all of them in our office. But if someone has a previous set of images, it will greatly benefit us because we'll see if there's been progression, or we'll see if there's been improvement or whatever in the curves. Make sense? Okay. Perfect. So everybody, thank you for coming. I know that's kind of a heavy subject, but you all did great. And so those of you who are patients, please bump up your commitment. And those of you not yet, if you want to be a patient or you want us to do that examination, it's $67, and Tamara will get you scheduled at a time that works for you. So thank you, everybody. Have a lovely evening, and I look forward to seeing you soon. Thank you.